Good morning. This is a video for students about your upcoming OSCE exam. A few students had asked us to give a little bit more information about how to prepare for this, what to expect, etc. etc. The first thing we should explain here is that this video is to give you tips and is not a description of official academic regulation or policy. So the exam might change slightly depending on the circumstances of the faculty at that time. Rather, this talk is just to give you a general idea of what you should expect and how you can prepare for the exam. So some of the common questions we get from students are things like, how will I be assessed? Or what topics might I be assessed on? How am I going to get graded? What's the best way to prepare? And are there any rules for the OSCE exam? So the first question, how will I be assessed? This video is focusing on your OSCE exam. So your OSCE is an objective, structured, clinical examination. And here you can see I put a red box around the words clinical examination. This is a clinical test, and so we are testing your skills at certain things which you will undertake as a clinician. So it's not really designed to test your knowledge, but rather your skills at certain things. Example of those might be things like history taking. So how are you able to take a history? Can you communicate with a parent? Can you undertake a physical examination? Do you know how to interpret labs and images? Now, of course, you are going to need knowledge to do all of these, but knowledge isn't at the heart of the test. The test is whether you are able to take a good quality, slick history, for example. So here we have a picture which gives an example of what an OSCE station might look like. So there's a candidate on the left who is being examined by the examiner on the right. Okay? And you can see that the examiner is holding some sheets which are probably his grade descriptors. Okay? So you can see in this picture that you may have a candidate, you will have a candidate, so you are likely to be that candidate. In this case, it's a communication station. Okay? Now, in a lot of these stations, you may find that a professional, like a doctor, is playing the role of a patient or a parent. At times, it may be that the same person is role-playing and examining at the same time. It depends on how many faculty are available. Now, this is a big challenge to students because you may know the person who is examining you. You know that they are a doctor. However, you need to get into the practice of speaking to them as if they are a patient. Okay, so using lay terms rather than medical terminology. Okay. The best way for you to do that is to practice with other students. Okay. Now, when you arrive in the station, it is pretty normal for you to be given a candidate sheet like this one here. Okay. Now, remember, we have limited printing facilities, so please don't write on these sheets as it will distract your colleagues afterwards. Okay, we don't have an unlimited supply of them. Having said that, you'll be given this candidate sheet and you'll have a couple of minutes just to read this. Okay, so in this case, it's a history taking station, okay, and a scenario is presented. Okay, that you're an intern, okay, you're in the OPD, and you're going to see a 2.5-year-old, okay, who's coming with some symptoms. Be very careful to read the instructions. The mark sheet will be based around the instructions. Don't do what you think the instructions are. Please do follow the instructions, because if you do something else, it'll be more difficult for you to score marks. So in this case, you can see that the instructions are to take a full and focused history, about 8 minutes to do that. And you are to speak to the examiner as if they are a parent. Okay. Once that is finished, your history, you would then need to give, based on your history, okay, what your assessment is, what the differential diagnoses are to consider, and what you think the most likely diagnosis is. Okay, and it's really important that you explain your reasoning. Explaining the reasoning will show the examiner why you're thinking what you are thinking. Okay, so you'll be given this candidate page on arriving into the examination room. Okay. Another question that sometimes students ask us are, what topics might be assessed? Well, paediatrics is a very broad topic, and we acknowledge that this is a challenge, okay, and it's many different aspects to paediatric medicine. But a good place to start would be in your logbook, where there is the description of the key topics that you are expected to learn during your paediatric assessment. This exam is trying to do a fair exam of what you have learned during the placement. So it's very likely that the exam will be based on one of the topics that are found here. Now clearly you're going to talk to your colleagues about what previously has come up in the exam, and that's completely natural. Okay, so I think it's pretty likely that you can expect that the topic that was in the last exam is not going to be in your exam this time. Okay, we change the stations each rotation to make sure that there's a fair opportunity for everybody to show their knowledge. Okay, and if we use the same exam every time, that would not be fair on the previous students because they did not have that warning ahead of them. Okay, so that's a good place to start when you're wanting to know which topics. Then how will you be graded? Okay. We're not out to trick you. Okay, we're not trying to cause people to fail. Okay, we use clear descriptions of how to give people grades. Okay, and we've given you an example of what that might be. Now remember, this is an exam that's testing skills. Okay, so a lot of the marks will be based on the skill that you're performing. So you'll see here that the marks are for your ability to take a history. Okay, so if you want to score well, you need to be good at taking a history, not having an outstanding knowledge of all paediatric medicine to a resident level. Okay, so the best way to learn how to take a good history is to practice, and that's where the marks will most likely be found. Okay. So what about exam day? What can you expect? Okay. Well, first thing to say is please do not leave any electronic devices in your pockets. Okay, no mobile phones, no tablet computers, nothing that is electronic. Okay, this would be deemed as cheating and is taken very seriously. Our advice is leave your phones at home. Okay, once the exam is finished, you won't immediately be able to get your phone if you do leave it with us, because we need to make sure that people don't communicate after the exam. Okay. Second thing is, do dress professionally. Okay, but there are no grades for the smartest dressed person on the day, so make sure you're comfortable. Okay, if you're going to get very, very hot, okay, you might find it difficult to answer questions. Nextly, the exam can be quite long, especially if you're waiting for your turn. Okay, and there might be a period of while you wait for your station to come up. So please bring a bottle of water, bring some snacks. Okay, if you are hungry or thirsty, you're going to find it very difficult to perform well. So probably the most common question I get asked, however, is how should I prepare? How can I do well in this exam? So let's go through a little bit of the road to OSCE success. Okay? Imagine you're learning to drive. Okay? You're learning to drive and you arrive in class and they say, don't worry, here's a book. You'll get everything you need to learn how to drive from this book. Okay? It's not possible. Driving is a skill. The only way to learn to drive is to practice driving. Okay? You cannot learn about it in the book. Okay? And it's very similar with the skills in medicine. You cannot learn to take a history from a textbook. You have to learn by practicing taking histories. Okay? So the simple biggest piece of advice to you is to practice. Reading books is not the key to passing the OSCE. Only practicing will improve your skills. Okay? So what are the tips to practicing? Well, seeing lots of patients on your rotation in paediatrics, asking people to give you feedback on your history, your communicating, etc. Next, find a study partner and practice together. Pretend that you're a patient and have your friend or your colleague to take a history from you. It's incredible what you will learn by pretending to be the patient or pretending to be the examiner. It will change your mindset for the exam. There are plenty of free cases on the Mock OSCE website which you can do to prepare for this, but there are also, you could create your own cases. There are also other websites. Okay, it's really important you practice all the different types of OSCE stations, so history taking, communication skills, examinations, etc. Okay, make sure you give each other honest feedback on how to improve. If you thought your colleague didn't do something well, tell them so that they can improve. But you'll find quite naturally from watching them that you actually learn a lot yourself about how you could improve too. Final thing is make sure you practice in the language that you will be examined. Okay, if you practice in Kinyarwanda and then turn up and have to do this in English, you might find it a lot more difficult. Okay, so this is the website where you can find some free cases to practice. Okay, So the very best of luck. We really do wish you the best, and we really do want you to succeed in the exam. We're not out to trick you. Okay, we really want to see you showing that you are able to be a GP, newly qualified in the district hospital, able to look after common pathologies in sick children. Take care.